Hello, everyone. Thanks for joining tonight. I'm excited to spend this hour with you talking about tooth whitening. And I know tooth whitening's been around for quite a long time, pretty much since 1989, when vital tooth bleaching was first made popular by trays worn overnight. And we've been whitening teeth really pretty steadily since then. I want to spend our time tonight talking about the mechanism of tooth whitening and why it's important that we offer it to our patients. Why does it matter? Well, tooth whitening is the #1 cosmetic procedure requested across all age groups across the US. So everybody wants tooth whitening. It's evidenced by how much you can buy just in how much shelf space is taken up in Target, Walmart, grocery stores, every Rite Aid, every Walgreens. An entire row of shelf is dedicated to toothpaste whitening products and tooth whitening rinses and gels and all of the things that people can buy over the counter. I think that we should all consider whitening in our office, offering it to our patients for lots of reasons. The #1 thing is it's the most thing they ask for. It's the one thing people want all the time. Secondly, it can really add to our bottom line. And the third thing is that if we don't offer it, people are going to go seek it elsewhere. And there's the possibility that they're going to maybe do it irresponsibly and or leave our practices. So we're going to look at a couple of cases today that came to my office and talk about how I treated them and how it's possible to build your practice, boost people's confidence, and boost your bottom line all at the same time. So the numbers are staggering. Americans are spending over 1.4 billion with a B dollars annually on over-the-counter tooth whitening products. So that means they're spending $1.4 billion outside our practices, outside our offices. So that's a big amount of money that we could be bringing to our own bottom lines and being responsible for the actual health of our patients, the health of our enamel, our patients' enamel, and their, professionally taking care of them in the way that we should. The other reason that I really love whitening and that we do so much marketing for whitening in my practice is because it is the gateway to additional cosmetic procedures. So I've been marketing whitening in Pittsburgh for 25 years. And we find that it not only brings whitening patients, but it brings so much more. I've built a pretty large cosmetic practice marketing whitening in Pittsburgh all of this time. And in today's day and age of social media, it really helps with patient retention because our patients are out there. They are Googling at night. They're all over Instagram, thank you, Kardashians. They're all over social media and they're being influenced by people that really have no training or any background in dentistry, of course, at all. And they're selling whitening products like crazy. All you have to do is, look all over social media, and these devices are available all sorts of ways. These little lights that really don't do anything, all sorts of whitening products, gels, toothpaste, rinses. Pretty much almost every influencer out there has some sort of product that they're hawking, and people are buying it to the tune of $1.4 billion a year. So how do we counteract that? What do we do about that in our practice that keeps people in our office, that gives them a result that is not only immediate, but is long lasting and satisfies their needs for whiter teeth, but at the same time does it responsibly? So we look at these things, the rise of influencer over-the-counter products, patient misinformation and misconceptions. We have Instagram smiles and patient expectations to deal with. And it gives us an opportunity for professional education and guidance. So these are the things that challenge us in today's practice as far as whitening goes. All of these influencers that are online, that are in our young people's hands, constantly barking at them that they have products that work. There's all this misinformation and misconception, and there's an avalanche of pressure from social media for patients to have white teeth, to have beautiful teeth. Younger people are seeking out cosmetic, not just cosmetic whitening, but cosmetic dental procedures and facial procedures and whole body cosmetic surgery in record numbers because of this, because of the influence of social media. So that's something that we have to be mindful of, and I think that we have to address. And if we're able to help these people, help people that want to, sort of respond to those pressures by having whiter teeth. If we can do it in a way that's safe for their teeth and long lasting, I think we're doing them a service. And I can tell you, it's definitely been a practice builder for me. I just wanted to share this case with you because this is a case that I see all the time. I have a practice where people come to our office seeking cosmetic work, smile consults, or how everyone enters our office. So we don't really see general practice people. We see people that are looking for something specific. And this lovely girl came to my office. She came looking for whitening. So we market whitening, and I've been doing it for a really long time. We use social media to market. We do it on through our patients, direct referrals, and 25 years of, oh my gosh, we started with billboards. We did radio ads way back in the day. Now I do a social media campaign where we're doing a digital campaign where we're on all the social media outlets and also direct emails to people sometimes. So this girl came to my office looking for whitening, and I say, I always ask them, so how come you're here? Because almost every one of these patients that come seeking out cosmetic care in our practice comes from a general dentist. They come from a dentist like this girl, someone she really liked. She'd been seeing for a very long time, and she had talked to them about whitening her teeth. And the dentist had told her, that doesn't really work. I don't think, I've tried it. It's okay. It's not great. Why don't you just go buy something over the counter? And that was the advice that she got from her professional office. And because of that, she went online and started Googling and found us and turned up in our office. So when we look at this patient, I sort of understand why her dentist may have judged a little bit and thought, does she really need whiter teeth? A little bit will be fine. Because, from her appearance, she is a girl that looks like she's very natural. She's not wearing any makeup. She's not, her hair is not like colored or all foofed up. She has a flannel shirt on. She just looks like a very natural girl that likes, an appearance that's not altered by, traditional cosmetics or, I don't even, what's the word I'm looking for? Traditional cosmetics or like procedures where she's, she's certainly not doing any plastic surgery or anything like that. So he sort of decided, she doesn't really need it. Go get some product, go get some Crest White strips or something, is what she told him. He told her. And so she went out seeking care and turned up in our office. So we start talking to her about her teeth a little bit. Let's see, I think we're going to get closer here. We start talking about her teeth a little bit and say, she has healthy teeth. Everything looks great. She's been going every 6 months, no restorations at all in her mouth, but she doesn't like her smile. And she wants to have a better smile. And that was her entry, was whitening. Let's talk about whitening a little bit. And she tried to talk to her doc about it and kind of got, you don't really need it. Or just get a little bit over the counter and that's all you need. But there's an opportunity here to do something more for this girl. And when I see this case, I start thinking about her uneven gum line. Of course, you're all thinking that, wow, look at that. She's really got some disparity between that gum tissue. And she has a little bit of, she's a little gummy, but she's also a little asymmetric, right? If you look at her right canine, it certainly looks lower than her left canine. But I'm sort of just focusing, what can I do for this girl to make her look better and at the same time satisfy her needs, but be super conservative, not risk her long-term dental health for making her smile look ideal. We don't need that. We need nice, we need natural looking, we need better, but we don't need to have an ideal huge 10, 12 veneers case. So I start talking to her about a little bit of gum sculpting and then veneers on just her central and lateral incisor. And these are going to be no prep veneers. These teeth are very flat. They're kind of like not showy at all. And I think if we put some gum sculpting on there, even out that gum tissue, only on her centrals and laterals, and then veneer those, she's going to look great, but of course we want to whiten everything else too. So we're going to whiten everything, gum sculpting, and then do some veneers for her. And this is what her end product looked like. So I've got the gum sculpting, which I did with the Gemini laser. That's a diode laser from Ultradent. I use it every single day. I love that piece of equipment. And I think they're getting another laser. Another one's being launched soon too. So I'm excited about that. But that Gemini Evo, I use it every day. Did some gum sculpting for her. And first we whitened her teeth. Then we did some gum sculpting. And then I put veneers, Emax layered veneers, very thin on 7, 8, 9, and 10. And you see what a difference that makes for her, how much more presence she has. Let's look at her side by side. That's before and that's after. And you can just tell by looking at her face, right? You can just see that that makes her feel better. She still has a little bit of asymmetry, right? She's still a little bit higher on the left than she is on the right, but what a difference that makes. And this patient came to my office specifically for whitening, an opportunity for us to discuss other things. This becomes a bigger case for us, but I think a really nice result for her, mindful of that long-term dental health, because I didn't take away any of her teeth. The gum sculpting is done without, just taking away excess gingiva, no biologic width violations, no long-term change to her periodontal health, and then the veneers whitening. Bam, kind of, right? I'm going to share with you my two favorite marketing, social media marketing we do for whitening. We say around the holidays, do you know someone who's dreaming of a white Christmas? And in the spring, not only the bride wears white. Those are our two kind of marketing, my favorite marketing tools I'll share with you. And our current patients, every intake form we ask, and every time we update a health history form, we ask, on a yes or no, you must check the box. Do you want whiter teeth? And are you happy with the way your smile looks? So do you want whiter teeth? Yes or no? They have to check a box. Anybody that says yes, it gives us an opportunity to talk to them about it. And are you happy with the way your smile looks? Yes or no? Anybody that says no, it also gives us the opportunity to talk about it. So then we can just say, hey, I see you want whiter teeth. Let me tell you about how we do whitening here in the office. We try not to say things like, would you like to know how we whiten? Because then people will be like, sometimes they're like, no, I don't really have time. Look at the time. Tell me next time. So we want to use these as an opportunity to just kind of dive in and talk about it. Let's spend a moment talking about the chemistry of tooth whitening. This is extremely important to know what's exactly happening in the chemistry of tooth whitening because it affects the way that we pick our whitening products, and it allows us to know why some things are successful, why some products are successful and some products are not so successful. And every time I lecture about this, someone raises their hand and says, I tried whitening and yeah, it just doesn't work for me. Just as a pain in the neck, it's not really worth it in my office. It just, patients aren't happy and I just tell them to buy something over the counter, like that doc did for our last patient. But if you kind of understand the chemistry of whitening, you pick products that work, you can be successful every single time, and your patients will be happy, and it builds your practice, and whitening alone will build the bottom line. So how does it work? We apply peroxide gels to the outside of teeth. And what happens is the peroxide gel diffuses down in through the enamel, where it breaks down into water, oxygen, and reactive molecules like like oh my gosh, like oxygen radicals is the word I'm looking for, the reactive oxygen radicals. And those break down the pigment molecules. So those reactive oxygens attach to the bonds of the organic stains that are deep inside the teeth. They break those bonds, making smaller molecules, and those smaller molecules do not absorb as much light as the big molecules, and teeth appear whiter. And these reactive oxygens move in all directions in the teeth. So if you put whitening gel on the surface of the tooth and it will diffuse into the tooth, and it'll move all through the enamel and the dentin of the tooth. It will not just whiten on the part you put it in. So we're going to talk about this in a minute. So you can whiten around orthodontic brackets. You can whiten underneath the gum line a little bit. So in a case like that patient we just did, where we're doing some gum sculpting, I whitened that patient first, whitened her, then we did the gum sculpting, and you will not see a demarcation between where the tooth was whitened and where it was covered with gums, because the oxygen radicals seep down through the tooth and diffuse all over it. So, several step process. The first thing that happens is we get the penetration of the whitening agents as it seeps through the enamel. And how that penetrates is dependent on several things. It's dependent on how long the agent sits on the tooth. It's dependent on the pH of the agent. It's dependent on the stabilizers that are put in the agent. And so those are different brands, have different stabilizers, have different pHs, and we'll get into that in just a minute. So penetration is the whitening gel diffusing down into the enamel. Then the oxidation happens. That's that redox reaction where the hydrogen or carbamide peroxide releases those free radicals, releases the oxygen radicals. So penetrates through the enamel, the gel gets in there, the peroxide or the carbamide peroxide breaks down into water and these free radicals, and those free radicals then react to the double bonds of these big organic molecules. So inside of all of our patients' teeth and our own teeth, we have these large organic stain molecules, and when the free radicals attach to them, it breaks them down into smaller molecules. Those smaller molecules have lower molecular weights, they're simpler, and the tooth appears whiter. That's how we get the color change. So when is a whitening gel successful? A, when it's fully potent. So that means that when it touches the tooth, diffuses in there, and that redox occurs, and the free radicals are released, it's fully potent, releasing as many free radicals as possible. If that gel is not potent when it hits the tooth, some of those free radicals have already been released. Some of them don't actually turn into free radicals, they turn into water instead, and they don't work as well. So we need stable chemicals, and that's related to the temperature sometimes of how they're delivered and the pH of those chemicals. So we want chemicals that have stabilizers in them that keep it fully potent until we put it on the tooth. Once it's on the tooth and it starts diffusing through, that's when it becomes reactive with the oxygen radicals. So chemicals that are fully potent, very important. In order to produce that high percentage of free radicals, it needs to have a pH of 7 or higher. So we want a neutral pH or a little bit higher pH. And many of the whitening gels that are out there on the market have low pHs. And the reason they do that is because that's helped stabilize them. So it's a balancing act between how can we get the neutral pH and at the same time keep it potent. And that's why we're talking about these products today, these Ultradent products, because they do these things. And then we want them to diffuse deeply into the tooth. So potent, they have to have a high percentage of free radicals, and they have to diffuse deeply into the tooth. And how do we get them to do that? We want contact adaptation, meaning we want the chemicals to be in, the gels to be in contact with the surface of the tooth as much as we can. We want the right concentrations of them, and it has to stay on there for the duration, has to be a certain amount of time in order to get those breaking of the big bonds underneath. Okay, so we know that that's what we want out of our whitening gels. We want them to diffuse well, we want them to be stable, but at the same time, the right pH, so we get the right number of oxygen radicals. And then we also want them to be adhered to the tooth in a way that allows those reactions to happen. That's what we want our chemicals to do. What are we trying to do with them? We're primarily trying to change the color of the teeth, right? We want to change the intrinsic color of the tooth, and that is primarily determined by the dentin, the reflections of the dentin. That's where those large stain molecules are, but it's affected by the thickness of the enamel, and that affects how we can diffuse the whitening product in, how much light is absorbed, how much is scattered, how thick the enamel is. Tooth discoloration has two factors. The extrinsic stuff, and that's what we prophy off with our prophy paste, staining on the outside, a lot of smoking stain, pigments from foods or beverages, sometimes minerals or metals on the outside, and we can get those off with our prophy paste, sometimes with brushes. We want to be careful never to use like smoker's toothpaste or anything like that, right? We're going to talk today about the tooth discoloration that comes from the intrinsic staining, and that's the internal staining. It's determined by our genetics. As we age, we get more and more of those large organic molecules in our teeth that have those double bonds. Sometimes antibiotics can make our teeth darker, fluorosis, developmental disorders, and peroxide-based bleaching is how we get rid of that, is how we remove intrinsic staining. So let's take a look at some in-office whitening. And in our office, we do combination whitening, and I'll give you the protocol just at the end of this little bit here. But we're using in-office products, and then we're also sending our patient home with products to use at home. And that combination of duration and the right product and the right stabilizers and the right pH makes for really beautiful whitening and long-lasting results for people. So these usually have higher concentrations of peroxides. They're 20 to 40% in office whitening. We want to make sure that we're protecting the soft tissue, and some systems have light activation. I know we all talk about, we all pretty much know that light activation is really not a determining factor for any kind of improvement in results, that light activation really makes no difference. But you saw all those influencers have those cool little lights they're selling people. So our patients sometimes believe that light activation is necessary. We don't use it in our office at all because we're getting beautiful results without, but you'll see systems out there that are offering it. I don't think there's any need for it or recommendation for it. They're usually 30 to 60-minute treatment times, and you can get a really nice shade shift. But there's always risks involved. So it's one of the safest, most conservative procedures we can do, tooth whitening, but there are risks. And one of them is increased tooth sensitivity. We all hear about that. Oh, I don't want to whiten my teeth. It hurt so much last time. And the second one, gingival irritation, is the other common one. Peroxide burns, either from in-office or at-home whitening. The ones we don't really talk about as much or are not as well heard of are you can get tooth surface roughening and or softening. This one's really important. There's an increased potential for demineralization. So when we whiten people's teeth, we can increase their potential for demineralization. And we want to be mindful of that and do something about that. And we also have to remember that you can get degradation of dental restorations or unacceptable change of dental restorations. So if you have somebody that has a lot of restorations, anterior restorations, they're probably not a candidate for whitening. Those are probably a candidate for switching those restorations or maybe even porcelain work for them. But if they've got a few, you want to make sure that they're sealed. And often we're talking to them about it, switching those restorations to different ones, to resurfacing and or putting new restorations after we're done with whitening if necessary. So desensitizing, there's lots of things we can do. There's potassium nitrates that you can, like Ultra-Ease makes, Alternate makes this one called Ultra-Ease that you can deliver in these disposable trays, and they can use it. Anybody that reports a lot of sensitivity in previous whitening, we usually give them a few of these trays to use 30 minutes, 3 days before their whitening, and it can really mitigate that a lot. There's also the CPP, ACP, remineralizing agents that can make teeth less sensitive to whitening before and or after whitening. So we use these before and after whitening. Anyone that reports they're super sensitive to whitening prior, we're using either Ultra-Ease or this prior to their whitening appointments. How about tissue burns? Tissue burns is the second biggest thing that can happen that is a problematic when we're whitening teeth. And we want to whiten, we want to isolate properly, but if you get a little leakage under your isolation, you can get a burn like this. So we want to make sure that somebody is with these patients at all times. We run 2 chairs of whitening at the same time, and I have one person one hygienist or assistant who is monitoring those whitenings. She will isolate one patient, put them with a gel, set a timer, and then go to the next chair next door, isolate the second patient, put the whitening gel on and put on a timer. And by the time she's done with that, she can go back to the first chair and change out the whitening gel and then go back and forth as needed. Because we don't want these patients to be by themselves ever. And we tell them, if you feel any burning or any heat or anything, let us know, and we will immediately suction off whatever the whitening material is. Sometimes we have to take off the isolation material, and you'll see something like this. But what happens if you get a little burn like this? You take off the isolation, you take off the material, you allow this to just sit, and it typically goes away. So there it is. After 10 minutes, it's almost gone. And 20 minutes, you can't see it at all, right? It's completely gone. Unless you have really let somebody sit with that peroxide on and burn them so they're ulcerated, it's going to disappear within a few minutes. We re-isolate and just keep going after that. And that's why you want to have somebody in the room with them so they can alert you, either give them a bell or just have someone walking back and forth checking on them periodically to make sure they're not feeling any symptoms. Okay, how about, so we know we can desensitize with some material before and or after if we have sensitivity. Tissue burns, if we isolate properly, we're going to be fine. And if you do happen to get a burn, they really go away pretty quickly, and you can not worry about those too much as long as you are monitoring those patients. The risk for increased susceptibility to demineralization. We all know that on the surface of teeth, on the enamel, there is a constant demineralization, remineralization balance going on, depending on the environment in the saliva. If we have more acidic environment, we are losing calcium and phosphate. It is diffusing out of the enamel into the saliva. We're getting demineralization. If we change the environment of the saliva, where we have more calcium and phosphate ions there, it's actually going to remineralize. We're going to rebuild the mineral structure of the enamel based on the content of the saliva. When we whiten teeth, we have the potential to increase the susceptibility to demineralization. So everybody that we whiten teeth on, we want to address that. There's no way to know who is more susceptible or who's been made more susceptible than other patients, which patient is and which patient isn't. So we treat everybody the same. And after we do whitening, we give them a remineralization product. So after they're done with their 2 sessions of whitening and their at-home product, we ask them to use the remineralization product till the tube is gone. So we give them some MI paste or some Remin Pro or one of these other pastes and have them use it for one tube. And then I feel like we're really mitigating that increased susceptibility. What's our protocol in the office? Our first appointment is consult and consents. We're consenting them for whitening. We're taking photographs. If they're sensitive, we'll dispense the desensitizer. Then they come for a 1-hour appointment. During that appointment, we isolate them and we white them in our office, typically 3 20-minute sessions with opalescence boost. And then we send them home with some product that they're going to use at home for 3 to 5 days. They return 1 week later. We do another 1-hour appointment in our office and dispense again 3 to 5 days of product that they use at home. And we dispense that remineralization paste. Touch up as needed. Then we touch them up as needed. This is the product that I love. It's a 40% peroxide product, and it also has potassium nitrate and fluoride built into it. We've been using this opalescence and opalescence boost for many years with incredible results. It's very, very consistent. But I do find that you do need to have a certain amount of exposure to it. So we use those 2 whitening appointments 1 week apart with product in between. And what is the product that we use in between is we send them home with Opalescence Go, which is 10 or 15% preloaded tray product with hydrogen peroxide. And we've been using this product for years too. I love it because there's no more custom trays that need to be made, and patients really love it. They can travel with it. It's super easy to use. And let's take a look at how that would work. So we're going to isolate the patient, and this is an umbrella, which is a a cheek retractor that also has a tongue barrier so the patient can't put their tongue forward. This works really, really well for isolating. Alternate product also. And it's really comfortable. So as far as cheek retractors go, this one is really comfortable. You see it has like these big silicone sort of bumpers that hold the lip up, and then the tongue is also being held back. Really, really important. So we're going to isolate with that, and then we're going to dry the teeth off and apply apply the opal dam, which is the, if you will, rubber dam in a syringe. It's the product that is blue and sort of sparkly, and it's light cured. And this is how we isolate the teeth each and every time. And all my assistants are trained to do this, and so are my hygienists. So everybody in our office can whiten, and because we do so much of it, and they really enjoy doing it because it sort of takes them off of whatever their regular daily routine is. They're dealing directly with patients, and they're dealing with happy patients because they're getting nice results. So you take the tip of that and you want to go interproximally as far back as you're going to go. So we're on the first molar here. We're going to put that gel interproximally and we're going to drag it up right along the CEJ, half on the gingiva, half on the tooth. I want to cover tooth and gingiva with about 1.5 millimeters width band of the opalescence, or the opal dam. And we're going to dry those teeth off, like I said beforehand, so they really adhere well. And we're just going to go around the whole mouth like that. Half on the tooth, half on the gum, all the way down into the interproximal, all the way around. Cure that all on. And then go back a second time and cover up about 3 to 4 millimeters of the attached gingiva. Just add that on there all the way across and cure that on. Whole thing, I don't know, what does that take? About 3 minutes to do. Everyone in our office can pretty much isolate a patient for whitening and get them started on a whitening procedure all inside a 10-minute seat. Chit chat a little bit, have them sign the consents, make sure their consents are signed, and then isolate them and get them going. So we're going to do that on the top and on the bottom. And then Alternate has these very cool, they're the syringe people, right? Has these very cool syringes. And this is one of the ways that they can make sure that this product comes to you 100% potent. So you're going to mix it right at the time of usage. So, that was one of the big factors. Is our material potent? And is it going to produce the right free radicals because it's at the right pH temperature? And are those radicals going to diffuse through the teeth, and can we keep them on the teeth? So it has like this syringe inside of a syringe inside of a syringe. So in order to activate it, you must depress the smallest syringe into the medium syringe first. And then you take both of those syringes and go back and forth, back and forth, back and forth, back and forth until you're pushing all the material. You're activating first and then pushing all the material from one syringe into the other one and then back again into the first syringe. And you do that 30 times, back and forth, 30 to, I've heard up to 50 times. It only takes a few minutes to do this, back and forth, but you're mixing right at the time of usage. And I believe the studies show that this mixed material will even last up to about a week at full potency. So you're gonna, it's not something that's gonna dissipate right away. You can use it up to a full week, and even a little bit more. So we will use typically the same syringe for the patient when they're coming in that week apart. So we're mixing it this week. We put it in a little bag with their name on it because we don't need all of it the first week, and we have them come back and use some more the second week. And then you push it all into the orange syringe, unscrew the syringes and put the top on, the sort of fuzzy top on the orange syringe. So all of the materials in the orange syringe, and it has this nice applicator top on it, which works really well to spread this material. And then we're going to apply it to the tooth. And because of the viscosity and the surface adherence of this material, it sticks everywhere you put it on the teeth. So we're going to get that contact adaptation and the diffusion that we're looking for. We're going to apply it everywhere, and then we put a timer on it. It's orange. You can see it everywhere. So in case it would happen to drop, or, sometimes patients will get crazy and they'll touch their teeth when you're not in there. how many times do you come in and they're holding up their thumb and it's all white because they've touched it and peroxide burned their thumb a little bit or their finger. But you can see it everywhere because of this beautiful red color, and it really, really sticks to the teeth. So you're getting all the things that we want to get out of a whitening product. Put that timer on for 20 minutes. 20 minutes later, we're going to come suck it all off. That's after 20 minutes. We're going to reapply, do 20 minutes, and then another 20 minutes. When we're all done with that, so 3 20-minute sessions on the timer, I would say 85, 90% of people get through 3 20-minute sessions, no problem. Every once in a while, you'll get somebody that's sensitive. And if they are, we simply stop. It's a rarity, but I may have them come instead of twice, they may come 3 times and do 2 20-minute sessions each time. A little tiny bit of extra chair time for us. We don't charge them anything extra for that because it's such a rarity. The opal dam comes off really easily, just pretty much comes off in one piece. Super simple. Then you see top to bottom, first whitening, you're gonna get really nice whitening. Now, if you don't do anything else at all, and this is what happened to a lot of people, they would just do it once, they'd look pretty good, and then they'd say, oh, it went away within 3 weeks. It was gone in 6 weeks. And that's why a lot of docs were like, yeah, I don't really do that anymore. But if you want successful whitening, you send them home with some product and you have them come back a week later and they do the same situation again. And you're going to get really nice results after the first time. They're going to see results with their home product. They're going to see really good results after their second whitening and long-lasting results from that second session of home product. These are vitamin E swabs. If you get any tissue burns or if there's people that touch it, we always have these around. We send them home with them. You just break the top on it and it leaks right out, and you can put that on and soothe the burn at all. We also send them home with the remineralization paste, either the Remin Pro or some MI paste, and really beautiful results. But you need to do those 2 sessions with a little bit of whitening material in between. People always ask, how long is this going to last and how do we maintain it? Well, it's dependent on a lot of things, right? We don't know if those bonds reform inside people's teeth or if new bonds form, but over time you do get relapse. So we recommend our patients that they touch up once a year. So every other time they come and get their teeth cleaned, they'll stay for a whitening appointment, and we pre-schedule that. So we know that the hygienist will clean their teeth and then she isolates them and does 2 20-minute sessions with the Opal Boost, again, with the Opal Essence Boost. She'll do 2 20-minute sessions with that every other time they get their teeth cleaned, and it will last indefinitely. It'll last indefinitely. Once a year, same day as a recall appointment, we pre-schedule that. Younger patients, we usually send them home with Opal Go once a year after their cleaning. We'll give them 2 to 3 trays. We charge them. We'll give for 2 to 3 trays of Opal Go and have them touch up like that. This is a new product from Opal Essence, which I'm very excited about. Actually, we all just got a box of it maybe like 2 weeks ago. The whole office was using it. It is very similar to the Opal Go in that it's a disposable preloaded tray, but it's a single tray. So it comes in a pack of 10 of these single trays, and the material is evenly dispersed throughout the tray through an injection molding process. Really easy to use. And I think we're going to be using a lot more of this than we do of our Opal Go. I think there's going to be a place for both of them, but I love this product. So let me just show you how that works. Comes in these preloaded trays. Each one has an upper and lower marked in there. Patient simply takes it out and pops it in their mouth, and the entire surface of that tray on the inside has the whitening material on it. So excellent adaptation. Upper and lower, they can wear them at the same time. They wear them for, depending on the concentration, there they are in the mouth. So they come in 10s and 15s. The 10 minutes, you recommend 30 to 60 minutes, and the 15%, 15 to 20 minutes, 10 days in a row. You take them out, patients simply brush their teeth. I sort of really like these more than the Opal goes in that they're environmentally friendly. So instead of an outside tray that you'd put in and then take out, it's just one material. So I really like that, really earth friendly, but the adaptation is lovely. The taste is good. I encourage you to try these. These work so well for younger people. We really sell so many Opal Goes to younger people. I see them using a lot of this home advanced too. It's really going to be amazing. I get this question a lot. Can ortho patients with braces whiten their teeth? And with these home advanced products, you can. The whitening trays are pre-filled, right? And they can fit right over the brackets. And we know that the whitening material doesn't go just where it reaches. It'll diffuse all the way through the surface and the internal dentin of the tooth and whiten everything. So these are great for orthodontic patients that have brackets on their teeth. And yes, it will whiten underneath the brackets. How about people that have clear aligners? So we whiten people, we're whitening people pre-restorative all the time. We're whitening people just that want to be whitened. Lots of young kids want to be whitened. We get that question all the time. How young can you whiten teeth? And if you ask me in my office, how young can you whiten teeth? We always say 14 years old, but tell me about your kid, because we frequently whiten kids that are younger than 14 years old. We just do it very carefully. We use products like Opal Go, and we're going to use Home Advanced for them. But oftentimes these younger kids have issues. They've got really severe coloring in their teeth. They have brown spots in their teeth, and they have things that need to be addressed. So I think it really is a factor of, can we do it carefully? And the answer to that is yes. And can we do it to help them with their confidence and their self-esteem? People with clear aligners, we love this product. The Opalescence 10%, carbamide peroxide, they can put that in there, sleep in it overnight. We sell a lot of this to our clear aligner patients, and we give a lot of it to our clear aligner patients too. It comes in blister packs of 2, and it's a big practice builder for us. So we're whitening everybody. Lots and lots of people are being whitened. What age do you whiten? We just talked about this. This is another really interesting case. This girl came to us looking for her teeth whitening and also complaining of the space in between her teeth. We whitened her and then closed that space with a little bit of composite, finished and polished. And she went from the top to the bottom. And in our office, this is a combination procedure of whitening and composite bonding. And this probably in the office, the two put together probably cost somewhere around $1,800 to $1,900. It is a procedure I love to do. It doesn't take a lot of chair time, but patients are so appreciative of that. She felt like a new girl afterward. You can just see how the look in her face, how much better she feels smiling. So combination procedures, market for whitening, brings so much other stuff in. I'm going to just sort of zip through these pretty quickly. We have, Opalescence Endo. I'd love to keep this in the office too for those non-vital teeth, for the non-vital teeth that get dark. People are coming to us all the time. It's a 35% hydrogen peroxide. You must seal your endo access with glass ionomer. So if you want to use this product, you must have glass ionomer in the office, and you must seal your gutta percha with glass ionomer, and then you can treat it with the Opalescence Endo. Here's kind of an example of what we do with that. This girl came to us looking for something to help her with this crown. She had had several go-arounds, and each time it was terrible for her. Beautiful girl, really healthy teeth, ended up with an endo on this tooth and a crown, and just, she had a big gray tooth, and I don't like it either. But what do? We take that crown off, and ooh, that's what it looks like underneath there. That is tough, right? All that gray is showing through the root all the way up. I don't care what you put on that, it's never going to look good. But we accessed it, sealed the glass ionomer over top of the gutta percha, put the Opalescence Endo in, and put a temporary crown on it. Sent her home for 5 days, came back, swapped it out 5 days, swapped it out one more time. So 3 rounds of Opalescence Endo in there, bleached it out really well. We ended up with that on the top. And then you can put a restoration on there that can look decent. Will it get dark again? Hard to know. It could. We told her it may. If it does, that means accessing from the lingual and whitening from the inside again, which we do on these dark teeth sometimes. Here's one on the lower incisor, same situation, super dark down there. No restoration on this one. It was endoed also. We simply access it through the endo access, remove the gutta percha down into about the alveolar crest, seal the top of the gutta percha with glass ionomer, and then place a pellet of the opalescence endo in there and cover it and seal it. Cover it with a little J-temp, send her home for a week, come swap it out a few times. The tooth will whiten up beautifully, and then we seal it with a regular core material or a regular composite material. Microabrasion is something we do with whitening a lot too. People that have these brown or white spots on their teeth, we combo this with whitening, and I find this is something that we do really frequently on younger kids. Lots of times kids come out of ortho like this girl, and they end up with these lesions that are not through the teeth, but they're dark, they're staining, there's white lesions and brown lesions together, and you can remove these really easily. Sometimes you can do it just with whitening, but I find that we need a little bit more. So we're going to do some microabrasion on these. I did a little gum sculpting on her too with a laser first. And then we're going to do some microabrasion. And this is a chemical slurry. It's basically 6.6 hydrochloric acid with some silicon carbide microparticles in it. And what it does is the hydrochloric acid removes the stain while those silicon carbide particles are polished in, and they mechanically remove the stain while the chemical of the hydrochloric acid is removing it. So it's happening together, chemical and microabrasion at the same time. So we're removing that, we're isolating with a rubber dam, applying that opal luster, polishing it on there, removing the stain. And this girl we sent home with an Opal Go pack. So 10 days of 15% hydrogen peroxide, 15 minutes a day for her for 10 days. And here she is after. So microbraided the brown stain off first with some opal luster and then some whitening. Now this girl wanted to have veneers, and I think, sure, could she get veneers? If we did no preps, absolutely, she could look different, but this was a huge improvement for her. You can see how much she likes it. And veneers were just simply not in the budget for her parents, and frankly, may not be the right thing for her anyway. This is so conservative. Beautiful results, very, very, very conservatively. Here's more of that brown staining. This guy's a little bit older. This was a pretty easy case. He had been this brown staining his entire life. He was about 24 years old when he came in, and it was like you could be like a dental hero. It took about 30 minutes to get that off. We isolated with a rubber dam, polished it with the opal luster. It removes the brown staining, and then we whitened him in the office, sent him home with some material to whiten again, and there he is afterward. Brown stain is gone, and that never comes back. That brown stain just does not relapse. So really works nicely. White lesions can be a little bit tougher. That's the imbalance between that remin-demin cycle we talked about, and that's what gets that chalky white lesion. And we see those with orthodontic patients, surface roughness sometimes, and something like this. The question is always, do you whiten first or do you microabrade first? And I like to whiten first a lot of the times, especially on a case like this, but I always tell them, hey, if we're whitening your teeth, these white spots are going to look whiter. They're going to appear brighter at first, but don't worry, as the body of your tooth whitens up, the white spots are going to fade, and then we're going to microbraid them out the rest of the way. So we whitened him and then microbraided him. And here he is top to bottom. And I know these are very subtle, these white stains, but this guy was so focused on them. He was really, really, really wanted them gone. This was something that really affected him. And although a lot of people would be like, can't even really see those white stains. But for him, it was important. And I think we made a big difference for him. Very conservatively, not taking away any enamel. I always like to pop this one in because everyone asks about activated charcoal. Patients for a while, there were so many influencers talking about this for a while. Activated charcoal toothpaste. I had so many patients ask me about this. So this is what I tell them. We know that activated charcoal is produced at higher temperatures than regular charcoal. It makes it much more porous, and that activated charcoal is really effective at filtering things. And influencers were saying if you brush your teeth with it, it's going to remove stain, acidic plaque, and gives you fresh breath, and it aided in good dental health. That's what was happening out there, right? But all the studies show, and this one in particular, that it was absolutely ineffective in changing the color of teeth. So charcoal toothpaste does not change the color of teeth, but it can result in alterations on the enamel surface. That roughness can change the enamel surface in a negative way. So the only result you can get from using charcoal toothpaste is negatively hurting your teeth. And that's what we tell our patients. We want to make sure that that's what we're telling them and that they understand that. We're going to spend our last little bit of time together just looking at another combination case and kind of just reinforcing why we need to do whitening in our office and how so many good things can come from it. This patient came to us coming out of, you see, she had some engagers still on her teeth. She was just coming out of Invisalign in her general practice. And she had talked to her doc about whitening, and he kind of said, when you're done, you can go get some stuff over the counter. And she also wasn't thrilled with this class 4 restoration on that tooth number 8 on her right central incisor. So when she came to us, we did a consultation with her. We talked to her about whitening and then replacing that class 4 restoration. So she went back, had the engagers removed, almost all the engagers. You can see tooth number 7 still had some engager left on it, right? And she was ready to whiten. So we did some whitening on her teeth, and then we replaced that class 4 restoration. So we took her through that 2-stage whitening. Look, she's that little bit of composite still on tooth number 7. But we took her back. We did 2 sessions of whitening with a little material in between, got this really nice color shift for her, and then replaced that composite restoration. And we used Transcend Composite to do that in a very simple layering technique. And here it is afterward. And you can see how, we got that nice translucency and the color build on there, and you can't see the restoration at all. And she went from that to that. And from right to left, you can see what a difference that makes in her and just in the way she feels about herself and her smile. So she left her practice, came to us looking for whitening. We ended up doing the rest of the dentistry for her, and she's kind of stuck in our office. Of course, we well, sure, we can keep you clean and whiten your teeth every other time you get your teeth cleaned. And now she's in our hygiene department, and it can just really boost your bottom line. We want to remember, I think this is the most important thing, to remember that whitening gel brands are not all the same, that even though, and a lot of people think this, a 35% is going to be the same, 135% or is going to be the same as a different brand 35%, because all that matters is the concentration. But that's simply not the case at all. In fact, you can get better results from a very stable 10% concentration than you can from a unstable, low pH 30% concentration. It all depends on, can we get the diffusion through the enamel? Is it going to be potent when it gets there? And is the duration going to be okay based on, will it stick to the outside of the tooth? So we want to choose stable bleaching gels because they have controlled oxygen releasing. Those oxygen radicals are controlled and potent. And what happens when we get those oxygen releasing radicals? We get more pigment breakdown, and that pigment breakdown is what gives us the long-lasting results. So choose your gels carefully. They're not all the same. They will react differently based on their stabilizers, based on their pH, and based on whether or not they can contact the tooth the way we want them to. You'll get beautiful results. Your patients will be happy with their results. It'll be long lasting, and you can really increase you can increase your bottom line in your practice couple $100,000 a year just by incorporating whitening into your office. It works, and it can work every time. This is my contact info. If anybody would like to contact me, I'm happy to take questions or, answer anything or just hear from you in general. I'm going to just stop sharing my screen for a minute so I can look at the questions. How can we bring whitening material close to the pH of 7? You really cannot do that. That's in the chemistry of the whitening material. So you want to research the material you're using. You want to use products that are already neutral or 7. You can't really, it's not up to you to change the product. It's built into the product. What material are you using to temporarily close the endo access between visits? I like a material called J-Temp. It's an alternate product. It's in a syringe, shocking. It's sort of like pinky, it's almost gum colored, but it blends in with any tooth, but you can see it really easily. And it's light cured. It's like a pinky kind of light cured composite material that works really well. It sticks to the outside of the access, so it doesn't come off. I like it a lot. How do you charge for in-office versus take-home versus yearly recall bleaching? That's a great question. So our in-office whitening for those 2 sessions is $650. That's inclusive of the material that we send home to the Remin Demon material. Oftentimes, if I'm bundling this with cosmetic work, we do a lot of veneer cases on the upper, whitening, straightening on the lower. We will throw it in. I'll say, you know what, we're going to throw this whitening in for you. If it's just straight up, we're charging them $650. It takes about an hour of chair time over 2 hours. That's 3.25 of chair time. $325 billable in your chair for each hour, and that's either a hygiene time or assistant time. So it works well for us. Home product, I think we charge them $89 for a box of the Opal Goes, and we'll charge them the same thing for that professional or for the Home Advantage, Home Advanced, which I really, really like. I encourage you to try that product. I think you're going to love it. And the yearly recall bleaching, that touch-up whitening that we do every other 6 months, we charge $275 for that. So $650 for the original 2 appointments, $275 for the touch-up whitening, and we charge about $100 for the take-home product. Do all teeth whiten? That is a great question, and the answer to that is it depends. They all whiten differently. All teeth do not necessarily. I always get a little bit of whitening out of every tooth. I don't think I've ever done a case, and I've done thousands of them, where we haven't seen some whitening. Does everybody get glowy white teeth? Absolutely not. And we have to set expectations for that. We tell everybody, you're going to get to a maximum whitening. I always tell them, and I don't use the shade guides, and I don't with my patients, I tell them you're going to get 5 to 10 years of whitening out of your teeth. So we gauge it in years. Your teeth will have 5 to 10 years of the color out of them. So they're going to look 5 to 10 years lighter. Younger teeth whiten better, but you have to be careful because we've got those big pulp chambers, right? So we tell people 14 is the bottom line, but we do whiten kids younger than that, and we'll whiten kids younger than that all the time, very carefully, very slowly. But no, all teeth don't whiten a lot. All teeth whiten a little. Most teeth whiten a really nice amount, and some teeth whiten a lot.